Welcome to the virtual preoperative seminar for bariatric surgery. My name is Jen Stein. I'm the patient navigator here at Saint Barnabas for bariatric surgery. I've been working with patients over the last 10 years to help get them ready for surgery. My background is clinical nutrition. I'm passionate about helping patients use nutrition to feel better and recover faster. Today we're going to talk a little bit about what to expect in the hospital when you come in for your bariatric surgery. We hope this information is helpful for you and your families. Welcome to the Comprehensive Recovery Pathway for Bariatric Surgery. This is the preoperative education class. Here's what we're going to cover today: how to prepare for surgery, what to expect after your surgery, recognizing and preventing complications, and follow-up care. Welcome to the pathway, the Comprehensive Recovery After Surgery Pathway, or we like to call it CRP. It's a care plan that we prepared for you by our Saint Barnabas Medical Center surgery and anesthesiology teams. Our team consists of nurses, physicians, dietitians, anesthesiologists. The clinical pathway will help you prepare your body for surgery, recover safely and faster, and return home as soon as possible after surgery. Why do we use the pathway? We like to keep your hospital stay short, keep your pain level under control, help get you out of bed and walk the day of surgery, allow you to eat and drink as soon as possible. It allows us to listen to your concerns and your feedback. We want to make sure that you're happy with your care when you're here at Saint Barnabas. What to expect before surgery. You will need pre-admission testing to make sure you are ready for surgery. Most likely, in some cases, your pre-admission testing can be done at your primary care physician's office. However, most patients will come to Saint Barnabas Medical Center for your pre-admission testing appointment. Pre-admission testing will get some blood work for you, prepare an EKG, X-ray, and a COVID test. The pre-admission testing screening interview will be done by one of our nurse practitioners. They'll ask you about your medical history and physical, your surgical history, any allergies or reactions to medications. They'll ask you for a list of your medications, supplements, and vitamins. Our preoperative team will take all measures to make sure you are screened safely. We'll use telehealth when possible, and we'll limit your contact and time in the hospital. Our patient navigator is available for an education session to talk about what to expect during your hospital stay, how to prepare for surgery, and discharge information. You will receive a patient recovery guidebook for surgery, and the navigator will give you a readiness bag with 2 preoperative carb-loading drinks, the Chlorhexidine cleansing wash, or CHG, and an incentive spirometer. What is a preoperative carb-loading drink? It is a drink that's going to help shorten the fasting period. It will decrease your thirst. It will help promote hydration. It will promote general well-being. You'll be instructed to consume 1 drink the evening before surgery and 1 drink up to 2 hours before surgery time. The old way of fasting before surgery is no longer done. We follow the evidence-based guidelines that encourages consumption of the carb-loading drink. If you have the first surgery of the morning, that's typically the 7:30 a.m. surgery, just drink 1 drink the night before surgery. The CHG cleansing wash. Chlorhexidine body wash is used to prevent surgical site infections. You'll use this soap in the shower the night before surgery and the morning of surgery. Please wear freshly laundered clothes after washing. Avoid using it on the face, hair, or open skin. Incentive spirometer. You'll use this after surgery to help clear your lungs, help make you feel better, and help prevent pneumonia. Typically, the incentive spirometer will be used. You'll take 10 breaths an hour to help exercise your lungs after surgery. Smoking and respiratory care. Saint Barnabas Medical Center is a non-smoking campus. We know that smoking can impact your recovery after surgery. We can offer nicotine replacement when available, and we have programs to help you quit before surgery. Pain management. Our preoperative team will meet with you before your surgery to evaluate you and your medical history and ask you about your current medications. They will also be available to help assess and evaluate your risk for postoperative pain. We use a multimodal pain medication here at Saint Barnabas to help with your pain after surgery. What are the goals of pain management? We want to help you achieve your therapeutic comfort level. The options for pain management are medications and intervention procedures. I'll explain the intervention procedure in a later slide. We also have additional pain management therapies, relaxation techniques, music therapy, prayer, meditation, and guided imagery. The nurses in the hospital will ask you to rate your pain on a scale from 0 to 10. Preparing for bariatric surgery. Please consult with your surgeon's dietitian before you buy supplements. Most likely, everyone having bariatric surgery will need a multivitamin, a calcium, vitamin D after surgery. Biotin, just make sure you discuss that with your dietitian, and a protein supplement. Here's a shopping list we prepared to help you get ready for after surgery. Go ahead and buy 4-ounce plastic containers for portion control. Diet Jello, please avoid the red colored. Sugar-free beverages, non-carbonated. Broth, chicken, beef, or vegetable. Decaffeinated coffee or tea. Sugar-free popsicles. And small dishes and spoons and forks. A strainer is also helpful. A food processor or magic bullet, and a protein shaker bottle. Speak with your surgeon about stopping medications that may increase your bleeding. Some of the medications are listed below. Anti-inflammatories, blood thinners, and even supplements can affect your bleeding. You should also check with your surgeon about other medications, blood pressure, heart, thyroid, diabetes, herbal supplements, and allergies to medications. Please follow your dietitian's recommendations for the preoperative diet. Some of the surgeon's preoperative diets vary, so make sure you check with your dietitian. The night before your surgery, you'll receive a call from our same-day surgical nurses the evening before your surgery regarding time and location of the surgery. They will also go over last-minute instructions for taking medications. Here's the phone number to call if you do not receive a phone call the day before surgery. Please drink 1 bottle of the Ensure pre-surgery drink before bed. It'll help you stay hydrated is important. It will help with your recovery after surgery. It's also going to decrease your thirst and hunger. What to bring with you to the hospital on the day of surgery. Your insurance card, driver's license or photo ID, and any co-payment required. If you have an advance directive, you should bring that as well. CPAP and BiPAP machines you should bring, and a list of current medications. You'll want to bring some loose-fitting cover-up, like a bathrobe, a walking shoe or sturdy slippers so you can walk around the nurse's station, personal toiletries, glasses, contact lenses, and cases. Leave valuables and jewelry at home, and please bring your cell phone and charger. The day of surgery, you may shower and brush your teeth. You'll drink 1 bottle of the Ensure pre-surgery drink 2 hours before your surgery time. Please do not wear makeup or nail polish to the hospital, and you'll report to registration, which is on the ground floor of the Cooperman Family Pavilion. That is the main entrance. The nurses in the surgical center will confirm what time to report to the hospital. It is typically 2 hours before your procedure time. In registration, they'll verify your personal information and have you sign some consent forms. After registration, you report to the first floor to our surgical welcome desk. They will guide you to the surgical center where you'll change into a hospital gown. More than likely, IV fluids will be started, and you will wait to be escorted to the operating room holding area. An anesthesiologist will meet with you before surgery to evaluate you and your medical history, ask you about your current medication, and discuss anesthesiology choices. In the operating room or OR holding area, again, your health information will be verified by either anesthesiologist, your surgeon, and nurse. The cardiac monitor will be applied and you'll be escorted into the operating room. In the operating room, you'll move from a stretcher to the OR table. They'll apply protective padding to prevent skin breakdown. Surgery time will depend on the type of surgery that you're having. Some of our patients will have an additional procedure at the time of their bariatric surgery, like a hernia repair. That surgery time will be a little bit longer. The surgeon typically will do an endoscopy intraoperatively to test for a leak. You will wake up in the operating room and then move into the PACU, the post-anesthesia care unit. There you'll be assessed by a nurse. We'll monitor your vital signs. You'll have oxygen in your nose. More than likely, if you're nauseous, they can prescribe some antiemetics for that. At this point, you'll only have ice chips. They will apply compression devices on your legs, and you'll have an intervention procedure called a tap block for pain. The anesthesiologist will visit you in the PACU and numb the nerves in your abdominal area so we can help with pain. Most patients ask me how long the tap block lasts. It usually lasts 12 to 18 hours. From the post-anesthesia care unit, you'll be transferred to a bariatric unit or post-surgical unit when a bed is available. In the nursing unit, you'll be encouraged to use your incentive spirometer. We're going to get you early feeding, a food tray as soon as possible. We also encourage walking in the hallways. You'll have compression devices on your legs when you're in your bed. And when you're up and sitting in your chair in your room, we'll encourage foot pumps, ankle rotations, and leg lifts. What is your dietary plan in the hospital? Clear liquids. We also call it bariatric stage 1. On your clear liquid tray, you'll have broth, water, decaf tea, Jello, and coffee, decaf coffee available. How do we assess when you're ready to be discharged? We want to make sure that you're ambulating or walking frequently, that you're using your incentive spirometer. We're going to leave your incisions open to the air. They'll encourage you to shower post-op day 2. That's most likely when you're at home. We don't want you to pick at the incision glue. That can cause an infection. The restrictions for hot tub and swimming are no hot tub and swimming for 4 weeks. And we don't want you to lift anything more than 10 pounds for 6 weeks. What will your diet be after surgery? We're going to have you check with your surgeon's dietitian for diet progression after hospital stay. Follow-up appointments. Typically, an inpatient nurse will call you within 48 hours after your discharge to see how your surgery went. 1 week after your surgery, you'll have an appointment with your surgeon, and you can expect follow-up care at 4 weeks, and then 3, 6, 12, 18, and 24 months with your surgeon. Yearly visit afterwards, and yearly blood work. When should you call the surgeon's office? If you're vomiting, your pain is not controlled with medication, you have a fever over 101 degrees, you have some bleeding, incision redness or drainage, even if it's warm to touch, you should call your surgeon, and whenever you have any questions. We have virtual support groups to help you on your journey after surgery. We meet the second Wednesday of every month, and it's led by a registered dietitian and a licensed psychologist. We just want to leave you with this quote and wish you the best on your journey. Nobody can go back and start a new beginning, but anybody can start today and make a new ending. Thank you.